Thank you very much indeed for asking me to come along today, or come along and sit in my home and talk to you. We've had two very, very impressive presentations, I would say, impassioned, in fact, both from Luke and from Andrew. I'm not sure I can carry over the same passion, but I'm going to talk very enthusiastically about some of the practicalities of research in social care within the NIHR context, but a bit more generally. That's a photograph there that I took very close to where I live in East Kent, on one of the few sunny days we've had in the last couple of months. What I'm going to do, I'm going to focus on the following three things. Firstly, some what I call long-standing challenges in social care, and I was delighted listening to Luke and to Andrew and looking at the chat. Quite a few of these things have been coming up already, and Luke, in fact, addressed some of these in his presentation. So I'll go through some of those challenges. I'll talk about some of the encouraging responses. I'm going to focus on NIHR in that. NIHR is not the only show in town, but I think it is the most important funder of social care research in this country, without any doubt, actually. And then briefly at the end, taking adult social care research forward. I put my email address at the beginning, I put it again at the end. Please get in contact with me. I have to shoot off after this talk to give another talk at 12:15. So I think it's 12:15, I better not be late. So apologies for that, but do get in contact with me if you want to pick up on anything I say. I'll be here for Q&A, but just need to go soon after that. Okay, so some long-standing challenges within the social care area. And as I said, I think what we heard from Luke were some of the practical challenges of doing research, of engaging people. And we heard from Andrew about some of the broader, indeed long-term historical challenges in the adult social care sector. So what I'm going to show on here, just bring these up. This is a slide that is borrowed with permission from the National Audit Office. They have produced a couple of reports. One I'll mention again a bit later on. This is the report they produced 4 or 5 years ago, which then described adult social care services. So in the middle of that slide, you can see these are the kind of this is their slide, their information, what they think is comprising adult social care services, but noting the considerable overlaps which have been talked about already today, with health services, with welfare and benefits services, with housing services, and with leisure and well-being services. So it's a very busy slide, but I think it just emphasizes, and I'll show you the emphasis again in a moment, it emphasizes for us that social care sits within this quite complicated context of activities and policies and domains of people's lives, and people who use services and people who provide support for those who use services or have social care needs don't think neatly around adult social care as something. They think about their lives and what they need to meet their needs and to satisfy their preferences, and what they might need could be delivered by adult social care, could come from the health service, could come from various other places as well. So we'd have to remember this sort of complex context within which adult social care is organised. And I just want to pick it up then in particular in relation to the NHS, because the NIHR, all the words in NIHR, nearly all the words in NIHR suggest health, but NIHR has always been responsible for social care research too. But as social care researchers like myself, we often tend to look over our shoulders at what's happening in health services research. And social care, of course, has these strong interfaces with the NHS. Now, there's much more research in the NHS and much more research on health topics. And one of the things I keep banging on about is that in the box there, is there potential to add in social care elements? I'm delighted when people do research, for example, on vaccination or biosecurity in care homes. I just wish sometimes they would look at some of the social care issues as well in their health services research in those settings. So if you are thinking about doing research, or you are already doing research from a health starting point, adding social care components is not usually that complicated and would be of great benefit, I think, to many of us. And then there are the health social care links. There are many links between the two systems. There are collaborative care models. There are boundary issues. People get different responses when they look to get support. There's strategic planning links. Prevention works across the sectors. Many people who care for individuals with long-term health conditions would themselves have needs for support, in this case from the social care sector. So many ways in which these things are connected. But in fact, and I'm going to show you the next slide, and I've shown this slide a few times before, the next one, and I always want people to go, wow. You can't do wow. As Luke said, it's a bit difficult doing wow when you're sitting in your own room. But this is a slide. It took me ages to do this slide when I first put it together. But I put it there because it just emphasizes that, again, this issue about boundaries. You can't get hexagons to link up with everybody else, but social care interfaces with education, with environmental policy, with criminal justice, with pensions, with migration. If you think about care workers, with pretty much anything on that slide. So social care policy and social care practice sit within this very complicated spectrum of public policy areas. And so we have to remember that social care research, therefore, may need to think about the boundaries or the connections, the interfaces with some of these other areas. So I've got 2 more slides in this little section, both of them are a little bit busy, but I want to just pick out, first of all, key adult social care characteristics that we should remember. Remember, when I say remember when we're thinking about what research needs there are and how to meet those needs through good studies. And for those of you that are perhaps more experienced in the health field than in the social care field, I think the contrasts with the NHS are really important to pick up here, because they do generate, I would say, some complexities. They generate opportunities, but they also generate some complexities for social care research. So firstly, funding. Andrew Dilnot told us very clearly about the funding context for social care and the mix of sources of funding: central government, local taxes, self-funding, which is growing very rapidly, and many other sources, including charities. Andrew also pointed out that state support is means tested, it's not universal, and that has important implications for delivery and type of services, particularly, for example, for people with dementia. Third bullet there, it's about eligibility and needs thresholds, and that will change, or those thresholds have an influence on who gets to use services or has their support funded by local authorities. All of those things you've heard about already, but they do characterize, they do influence the policy that the research needs to go on. And then some other things which perhaps didn't come up so much in the previous presentations this morning. One is the primary objective is well-being. I often say that the purpose of social care is not to improve health, not primarily at least. It is to improve well-being, but of course, if it can do something to help health, that's great. But the main focus is not health. One thing that I get into trouble from and get told off from time to time by different people in NIHR is for publicly commenting on how NIHR tweets and publications and so on forget the well-being part. They talk about health as if social care is only concerned with improving health. It isn't. Okay, so we have to remember there are many objectives that a social care service is trying to pursue. There are local decisions. Each local authority is itself a little social care system, and that can mean potentially wide variations. What happens in one part of the country, what doesn't necessarily happen in another. That's a great opportunity for research, of course, but it also makes it a bit more complicated when you think about generalization. The next bullet down is about families and other carers playing huge roles. So I think research nowadays, it'd be very surprising to see a research study get funded which ignored the carer angle where that was relevant. And that is relevant for most adult groups who have social care needs. So the carer angle is important to include, even though it actually adds a bit to the research budget, makes it more complicated. There's a limited evidence base. Luke talked very clearly about this. There isn't a lot of evidence sometimes to guide decision making in this area. And a bit later on, I'll talk a bit about the point that came up in the discussion in Luke's session about the researcher practitioners. There aren't very many people who are practitioners as well as researchers, but I also share Luke's optimism that might be changing. So it's a limited evidence base. We have a large delivery of social care services outside the state sector, completely different from the NHS. So this is a problem. Private sector providers or non-state sector providers, perhaps not experienced in research, come back to that in a moment, but I put this little quote in here, which somebody said to me many years ago about when internal markets were introduced into the NHS. And somebody said, okay, we've got a market in the NHS, but it's just playing shops, the sort of things you did as a kid. It wasn't real markets. Now, that's not entirely fair, but what we've seen in social care is that providers go out of business. And that has huge consequences for the people who are reliant on them for their services. So they're real markets, and that is a challenge for a whole range of things, including for research. Got this issue about staff. Many staff are low in terms of qualifications, very high in motivation, I would say. We've seen that very clearly in COVID, but they have low pay, they're often high turnover, and although there are social workers who will have some degree of research awareness in their training, for most social care staff, that isn't the case. Care is mostly low tech, so personal relationships matter importantly. And last point is many people with social care needs, or at least some people with social care needs, are not well placed to make choices. They are reliant on support from others in those respects. So I went into that quite some detail and just hinted at some of these challenges then for the adult social care sector. So there's issues around limited funding, there's issues around the supply of researchers. There aren't that many people still who are doing research in adult social care, although I think it is growing now quite speedily, I'm pleased to say. The point about practitioner research, as I mentioned already. There are questions about methodology. I was waiting to see what Luke said in response to the question about randomized control trials, and he said exactly what I would say, which I was pleased to hear. So I think there are questions about how different methods get received in social care contexts, and I think social care researchers have been hesitant about using some of those, perhaps sometimes more robust quantitative methods. That's not to say that social care research is poor quality, it's just had perhaps a more limited range of methods than health. There's a lack of collective identity. It's not easy for social care researchers to engage with each other. I'll show you how we're trying to do that in a moment. There's a weak research culture in the social care sector itself. We don't have the same, I would say, with members of the BMA, if you're a doctor, you get the British Medical Journal plopped through your letterbox every week. There's no equivalent for social care of that sort of research-based source of information. There's an issue about lack of support costs. NHS research can get support costs to help engagement. That doesn't happen in social care. It's beginning to come in, and we're trying to work on that. Then there's questions about research infrastructure. I'm going to come back to that a bit later on. But I think what's happened in local authorities in recent years with the demise of their own internal research organizations, research groups in most authorities, they've also lost that experience in managing research and governing research, and that can make it difficult sometimes to get into the authorities. And then there's issues around recruitment of people into studies, and I'll come back to that in a moment. So what I've tried to set out there in that first section then was some of the challenges, I would say, in doing research. I don't wish you to leave my bit of the presentation in any sense of gloom, because lots of things are coming up which are improving the situation, but it has been challenging. So what then are the responses? Now, what I put on the slide here, which is a very busy slide again, is a number of the, I would say, significant NIHR achievements in the last few years. So NIHR has been very supportive, energetic, very committed to grow social care research for adults. That's the remit that DHSC has, is for adult social care, not children's social care. But really keen to push that. And there are many ways in which that's happening. I'm not going to pick out all the details on the slide, but just need to explain some of the acronyms for those who aren't familiar with the field. So there are programs, particularly the policy research program that NIHR runs, DHSC runs. They've set up these things called PRUs, which are policy research units, and there's one in adult social care which is led by my colleague, Jose Luis Fernandez at LSE. That was initiated just 2 or 3 years ago now. And many other policy research units have a requirement to do social care research as well as their other activities. We're going to hear from Laura in a moment about the Research for Social Care call, and there are many other things that happen. So the programs, the existing programs within NIHR have been putting more emphasis on social care. There's a School for Social Care Research, which I'm going to explain to you in a moment. ARCs, these applied research collaborations, which exists regionally. I may have got the ARC explanation wording wrong, but anyway, there we go. These applied research collaborations. And they were asked to look at social care within their new contracts, which have been going for a couple of years now. So that's improving things. Clinical Research Network, I'd love to see the word C changed from clinical, but these research networks are there to support research, not just in social care, not just in healthcare, but in social care. Research Design Service is putting more emphasis on it. NIHR Academy, which grows, tries to invest in new skills and new researchers, has also put a lot of emphasis into this. I'll come back to that. And we see much more attention paid to involvement of people in research and getting their priorities. So let me go say something about the NIHR School for Social Care Research. So I've been the director of the school since it started in 2009, and we've gone through, we're in the third 5-year phase for the school. You can see the mission there at the top of the screen. Mission was given to us by NIHR, and in the third phase down here, which started in May 2019, there are 7 universities. We have a budget of £18 million for research effectively, and £3 million for capacity building. In an NHS health services research context, that doesn't look like a large amount of money. In social care, it's a fortune. So we can fund a lot of research with that. So the university members are here. And what we do is we commission research from those 7 universities. That's the expectation. But we also have an external call, and I'll say a bit more about that later on. We've had 2 external calls for people outside the universities, those 7 universities, to conduct research. And lots of emphasis now on capacity building. We'll come back to that in a moment. So this is just a screen grab from the SSCR website from whatever date it was on there, 22nd of May. You can see what I did. So the other day, the weekend, or whatever it was, I did that. But you can see it's a busy website, lots of things on there. And I'm going to pick up 1 or 2 things here about things that might be helpful in understanding what research is around, in thinking about doing new research, in thinking about doing a research career in social care or developing a career, because there's lots of things that the school, NIHR School, is offering. So we have these things called findings. And these little things, there's 1, 2, 3, 4 covers on the screen there. These are 4-page, usually 4-page, sometimes slip over that, but 4-page summaries of completed projects funded through SSCR, and they're written in what we hope is sufficient. They're not easy read versions. There are easy read versions for some, but they're written in sort of lay language, not, we hope, written in technical language. We do try hard to avoid that. And they cover any completed study. Every completed study that we have is contractually required to produce one of these, and they don't get their final payment until they've done it. So these are on the website. There are 63 of them there. Have a little look if you want to get some. And over time, you will see a growth in spread in coverage and growth in numbers. And this talks to that growth in numbers. These are the projects, some completed. And you can see there's mismatch between the number that are completed and the number of findings that are on the website. We're working on that. But you can see the number of projects in different areas. I put type of research. So there's some research projects, some methods reviews, some scoping reviews, some fellowships, which then lead to support, funded support. We do the research in a variety of different settings. You'll see some familiar social care settings down there, as well as some work. There's at least 2 studies I can think of social care delivery in prisons, for example. These are I put client groups, but the groups of people with social care needs. You can see the mix there. These are not mutually exclusive groups. They overlap quite a lot. And then some themes, just ways in which we've categorized the projects on the website. The point is, there's lots there. So if you're looking for research evidence, there might be some there. If you're looking for examples of research to help to structure your own study, there might be something there that's useful too. We then, from time to time, would commission particular pieces of work. This is something that I was a co-author of, in fact, but we were interested in response we got from lots of the projects that they were having difficulty recruiting people into studies. And so what we did was to look at what the experiences were in a number of our completed studies and try and find out what had worked in getting people to participate, in getting organizations, care homes, local authorities, individual service users, individual carers, what had helped to encourage them to participate. I won't go through the details on the slide. You can download that document. It's not very long. But just, again, it's an attempt to kind of distill from the busyness of research some of the lessons that might be helpful to other people or be helpful to ourselves in the future. We in SSCR support the Enrich website. So Enrich is a toolkit for care home research. It's run primarily by CRN, Clinical Research Network, but we maintain the website. And if you are doing research or think you're doing research in care homes, it's a very, very good source to go to get some examples and some advice. We run webinars. I'm not going to go through everything we do. I've got one more slide after this, but we run webinars pretty much fortnightly. And they've been great, I have to say. We've had, I think the highest participation we have is about 280, but we get regularly between 50 and 100 people who can sit there. I usually sit there with this camera off so I can eat my lunch without people having to see how gross my eating habits are. But I think, you can sit and join. And one of the things I'm going to come back to at the end, one of the lessons from the COVID period, from the lockdown and so on, is that this sort of webinar works. And there are people on the meeting today, I'm sure, who would not have traveled to a meeting in person, couldn't have traveled in some cases, either because of their own circumstances or their preferences. So this kind of event can work, and wherever possible, we record. Sometimes our speakers don't want us to, but wherever possible, we record the webinars and they're available on the website. So again, there's some useful material there. And one of the things we're doing, I'll come on to the next slide now, is this thing here. The second bullet says capacity building. We have some additional funding in this phase of the school to try to help people to enter social care research careers or to develop those careers. And I'll show you the things we're doing at the moment. And then some of the webinars are very much around particular approaches to research, particular methods, particular experiences, which we hope will be helpful to people as they plan and develop their careers. One more thing I wanted to say, because I added this in on hearing a question in the previous session, was about access to research findings. I've shown you quite a few of that already. We also set up this thing called the Journal of Long-Term Care, which is free to submit and free to read, and it's online. So unlike other journals, we're not trying to make money. And there's something called Social Care ELF. If you haven't come across the mental ELF, which you can't say without smiling, but the mental ELF was set up as a way of trying to communicate research in the mental health area by people writing a blog about somebody else's study. And we have got the Social Care ELF, which is just beginning. It was dormant for a while. We're just reviving it out of winter hibernation. Once winter ends, it'll be very active. Okay, and then capacity building. I'm going to talk about that. This is the things we're doing. So on the left-hand side, you can see a little screen grab from the website. We have career development awards. We have PhD studentships. We have developing research leaders awards. We have practice-based research leader awards. We have internships, and then we have various other programs and so on. So we have these awards. Some of them are live now, applications you can put in. We are trying to bring people in from practice careers to become researchers. We're also keen for people that are researched in a different area, maybe health or public health or geography or somewhere completely different. They might be able to come into social care research. And we've got these awards to try to help people to do that. We've also got, I think now, about 14 PhD students funded through this program. Some of them are doing fabulously well. Some of them are struggling a little bit because of the pandemic, but they're all together and supporting each other to work on social care topics. Okay, so taking adult social care research forward. I've just got 3 slides to finish. So firstly, just the impact of COVID, and this came up in previous discussions this morning. This is a slide with colleagues of mine, led by Adelina Comas-Serrera at LSE, and colleagues at Nuffield, that are working on how social care can respond to COVID. Recovery and resilience is a key phrase in the project title. It's funded through NIHR, not through the School of Social Care Research, but NIHR more generally. And we can see the challenge. So we know what impact COVID had in care homes. If you're watching this slide and not looking to see what Dominic Cummings is spilling in the House of Commons committee at the moment, but I hope somewhere along the line he tells people how it really was in relation to the neglect and the damage done to care homes, which seemed to be almost willful. I'm sure it wasn't, but it could have been a lot better done. Anyway, we've seen this huge challenge, so that's changed the context quite considerably. What we've also seen in recent months, since February, we had a white paper on health and social care, but actually not much social care in there. That was pretty disappointing to people, didn't say very much. We had the Chancellor's budget, which said even less. I think it had social care mentioned once or twice, I think. And then this quite interesting report, I think it is an interesting report from the NAO. National Audit Office do very good reports on whatever they look at, and this is a kind of stock take on the adult social care market, a particular aspect of social care, but very, very good up-to-date picture of what's going on. So then, final slide from me, some new research contexts which we need to think about, I think. And some of these came up already. Luke particularly mentioned some of these earlier. So I think when we're thinking about designing research, commissioning research, using research, there are some things that I think are more important, have got greater emphasis now than perhaps was the case previously. And the first three bullets, I think, emphasize that. Firstly, that well-being matters. Social care research should be focused on well-being. It should look at health, but it's primarily concerned with the well-being, broadly defined, of the people with needs and their carers. Secondly, we need to think about preferences. What do those people want? Not paternalistically decide this is what's good for them, but what do they want? And that should be part of the research picture too. And the study that Luke talked about that he and Baz were involved in is a good example of how that can be captured. And thirdly, rights matter. I think we've seen that the fact that COVID has imposed such restrictions on care homes, for example, raised or re-raised, if you like, the issues of rights. Fourth bullet, involvement has never been more important. It's been there. And again, Luke gave a very good examples of when that needs to be done, which is from day one or day -1. But involvement needs to be there from the very beginning. It's never been more important. Fifth one is the visibility of good science. What's come out of the pandemic, I think, is a much higher profile for research mainly around vaccinations and infection control and all sorts of other things. But science, I think we can see that science can help to improve policy and practice, and we need to build on that in social care too. And then 3, perhaps new modes of working, data collection. My colleagues, me and my colleagues in our research applications, research projects rather, are now collecting data online. That works fabulously in some cases. It doesn't work at all in some other cases. So new ways of collecting data, new ways of dissemination. I'm using the word deliberately, dissemination, rather than knowledge exchange there. We are finding ways to push findings out there and then engage people through knowledge exchange in an appropriate way. But the webinar thing I mentioned earlier is a good example of that. I'm sure post-pandemic, whenever that is, we will not drop our webinar series, for example. It's just been too successful as a mode of communication, even if it's not the only one or the best one for some purposes. And then I think there's much, much more emphasis now on implementation pathways. How do we then translate these research findings, the sort of thing that Luke made 2 or 3 times? We mustn't just, when I first produced my first research paper, which I'm not embarrassed, I'm pleased to say, it was 45 years ago, for goodness sake, I published my first journal article. But I just thought that was it. I published an article in the Journal of Gerontology. I was going to be famous and the world was going to change. And of course, that's incredibly naive. What we need to do now is a whole range of activities to make sure the research findings get out there to have an impact. Okay, and I don't think I've got any conflicts of interest to declare, and anything I've said is my view entirely and not those of any of my funders. And so I will stop there. Thank you very much.